It is very common to go online and browse treatment for polycystic ovary syndrome PCOS after getting the diagnosis, and you get several results from using the pill, weight loss, glucose and insulin controlling medications to restrictive diets, and even a number of supplements. And this makes most ladies feel really overwhelmed. Now, when I speak with women for the first time, I always make sure they have gone through a two-step process before seeking treatment options. The first step is what I talked about in depth in my previous video, PCOS, how to know if you really have it. Because trust me, countless number of women have been misdiagnosed. You don't want to start treatments you don't need or opt for some that wouldn't work, thereby worsening your symptoms. The fact that a few cysts were seen on ultrasound is not enough to say you have PCOS. There are a few other criteria to consider. You can always go to the link in the description to watch that video after seeing this one. My name is Onome Stephanie Nyong. I am an internationally certified women's holistic hormone health practitioner, and in this video I'll be talking about the second step, which is knowing the type of PCOS you have and how to treat it holistically using healthy lifestyle changes and supplementation. There are about 4 different types of PCOS which require completely different treatment plans. 1. The first and most common is the insulin resistant PCOS. Insulin is the hormone that converts the sugar in our body to energy that can be used by our muscles for bodily functions. So when we eat a meal, say carbs for example, your blood sugar increases. Then insulin is secreted to activate your cells to take up this glucose, thereby reducing the sugar in the blood. So this could be taken up by your muscles for your normal bodily functions, or it is stored until when needed. In insulin-resistant PCOS, your cells do not respond to taking up insulin. The blood sugar remains high, and because of this, the pancreas keeps putting out more and more insulin, hoping to reduce the blood sugar. These high levels of insulin will then trigger the production of androgens like testosterone from your ovaries, which will prevent ovulation. It is these high levels of androgens that cause the physical symptoms like acne, male pattern hair loss, weight gain around the abdomen, excess hair growth on the face, neck, and body. Insulin levels need to be checked to confirm this kind of PCOS. With this type of PCOS, you need to be patient because treatment takes time and you have to be consistent. First, you need to address your diet. Reduce carbs, add protein and fats to your diet. Try your very best to quit sugar. Sleep well, have a sleep schedule, it helps. And then manage your stress levels. Try to reduce stress at all costs. Supplements like inositol, berberine, magnesium, chromium, and even NAC and acetylcysteine. It's a long list, and you need to speak to a professional before choosing supplements. Engage in exercises to improve insulin sensitivity. When you engage your muscles regularly, it will help in taking up some of this blood sugar lying around. Number 2 is post-pill PCOS. This type of PCOS happens when a woman goes off the pill, that is the birth control pill. The pill, like you know, already suppresses ovulation by shutting down the communication between the brain and the ovaries. In some women, after stopping the pill, ovulation will resume, but for some others, it takes a longer time. In post-pill PCOS, you find that ovulation is not happening in addition to the physical signs of PCOS. I guess you are also aware the pill is often prescribed for acne. This is because the hormones in the pill suppresses the production of androgen hormones. High levels of androgens cause acne and other physical symptoms of PCOS. So when a woman stops the pill, there's a sudden increase in the level of androgens, which is temporary though, but causes the manifestation of physical signs of PCOS. And there may also be polycystic ovaries seen on the ultrasound. But one thing to note is, with this type of PCOS, there is no insulin resistance, and it often resolves within 6 to 12 months with the right nutrition to help resume ovulation again. So if your cycle was normal before going on the pill, it shouldn't take too long before everything gets back to normal. A supplement like zinc is helpful in reducing androgen levels. Herbal supplements like the Vitex and chasteberry works very well to kickstart the brain-ovary communication again so that you can resume ovulation. Again, sleep and stress management is also very important. Number 3 is the adrenal PCOS. In this type of PCOS, it is the androgen hormone produced by the adrenal glands on top of the kidneys that is high. In this case, DHEAS, so the androgens produced by the ovaries like testosterone and androstenedione are normal. Because this type of PCOS happens in response to high levels of stress, the woman will also have high levels of cortisol, that is the stress hormone. So you have to manage your stress levels in order to improve this kind of PCOS. And you can do that through certain relaxing activities, supplements like the rhodiola, ashwagandha to cope with stress, and nutrients like vitamin B5 and C to support the adrenal glands and the nervous system. Improving your sleep works very well. Avoid coffee and drinks containing caffeine. And the last type is called the inflammatory PCOS. Inflammation in the ovaries causes the production of testosterone. So here, in addition to meeting the criteria for a PCOS diagnosis, the woman will have signs of inflammation, which could be headaches, thyroid disease, fatigue, joint pain, skin conditions like eczema, hives, and also issues with digestion. So to further confirm this type of PCOS, there is no insulin resistance, or you find that the woman isn't in a post-pill phase, meaning she isn't just coming off the birth control pill, right? And inflammation here could be caused by your diet, your lifestyle, stress, toxins in your system. To improve this type of PCOS, a woman will need antioxidants like NAC, anti-inflammatories like zinc, turmeric, omega-3 fatty acids. You also need to address your gut health by balancing the bacteria to improve digestion. Avoid dairy products and other foods that trigger inflammation. And manage stress. Like insulin resistant PCOS, treating this type also takes time. So you need to be patient and consistent. So you see why proper testing is important. If not, you may just be undergoing treatments that won't work for you or even worsen your symptoms. So if you want to talk about PCOS symptoms, testings or treatments or supplements that can help you personally, you can always book a consultation with me. Link is just below in the description or below this video. You can also check out links in the descriptions for very helpful resources. See you again in my next video.